Good afternoon, everybody. Welcome to this webinar. I hope that your week is going well. I hope that you are having a good Thursday, and you are very welcome to this webinar looking at transitioning to Best Start Family Hubs. If you are able to put your camera on, it's always lovely to see some smiling faces, so please feel free to do that. But if you keep your microphone on mute, that will be really helpful as people are arriving. Welcome if you're just joining us. We've got quite a few people signed up, so people will be coming in, but we will get started in just a moment. We have a stellar panel for you this lunchtime, and they're all very keen to share their wisdom and experience. And I know that will be really helpful to many of you who are in the process of operating family hubs or setting up family hubs or transitioning to that model. Just give it one more minute and then we'll get going properly. Welcome to those who've just joined. Please don't worry about eating your lunch. I know that for many of you, this is your lunch hour, so please, if you need to munch away, then please do that. I hope you have some refreshment there as well. If you need to keep your camera off for that, you'd rather not see us see you eating your sandwich, then that's absolutely fine. Please don't worry. You are all busy people. Good to see so many of you here. Exciting time to be working in this field, but also quite a challenging one. So hopefully the 60 minutes or so you spend in this will be fruitful and helpful in that work you're doing. Okay. Bit of housekeeping to start off with. First of all, welcome. Good to have you with us. I am Peter Leonard. I am the Chief Executive of the Centre for Emotional Health. And in a moment, I'm just going to tell you a little bit more about who we are and what we do, in case you do not know. I'm joined by some of my team here today. Rowan, who is our Director of Training, is also on the call. So there he is waving away. Also, I have Alison, who is our Head of Business Development. I have Robin, who is our Head of Impact and Research. And I have Thomas. And I've left Thomas to last because Thomas is our training operations lead, but also our tech expert. So if you're having any issues with tech in terms of seeing anything or hearing anything, then please do speak to him in the chat. And if you use the chat to communicate with him, then he can hopefully help you out with anything that you need to check on. We also have a Q&A section. So in a bit, when we come to our fantastic panel, who I'm about to introduce to you, then if you want to ask the panel a question, then please, if you could type that into the Q&A and not the chat, that'd be really helpful. And then we can make sure that we collate it and get through as many as we possibly can, because I suspect there might be quite a few. So please do use that. We've some have been submitted in advance, and thank you very much for doing that. This webinar is being recorded and will be available afterwards to those of you who have booked onto it as well. Yeah, I think that's everything I need to say about that. So I just want to introduce our incredible panel. So we have got from Buckinghamshire Council, Jane Foster, who is the Family Hub Teams Manager. We've been working with Jane for quite some time now, and delighted she's able to come and share her wisdom. From Halton Borough Council, we've got Adam Hindhoff, who's the Strategic Lead for Early Help and Family Hubs. and Angela McManus, who is the Parenting and Healthy Relationships Coordinator. And they're going to share some of their experience with us as well. Liverpool City Council, we have Lisa Lunt, who's the Parenting Coordinator. And we also have from the National Centre for Family Hubs, Flora Wilkie. Flora, thank you for joining us today. We appreciate that very much. And we also have Matt Baller with us today. Matt is an early years specialist, teacher and children's author. In fact, I think he was teaching Year R this morning. Were you not, Matt? Yes, he was. So straight from the classroom. And Matt's going to be sharing some stuff about GLD with us in a short while as well. So that is our fantastic panel, and I'm going to bring them in as quickly as I can. Before I do that, I just want to say a little bit about who we are and why we're hosting this webinar in effect. I have shared, I hope, a PowerPoint slide deck. Can someone indicate to me that you can see that? Because from this side I can't. Amazing, thank you so much. I'm a tech expert, I told you. Here we have transitioning to Best Start Family Hub. So we are the Centre for Emotional Health, and our vision is for everyone to live an emotionally healthy life. We're a national charity. We used to be known as Family Links, and some of you may have used us before, used our programs before. Our core program is the Nurturing Program, and all that we offer is based on that. We work to raise awareness of what emotional health is and have a full range of evidence-based universal programs for parents and carers of children between the ages of 0 and 19 years, all based on the Nurturing Program that develops those 4 building blocks that are on that diagram there: self-awareness, appropriate expectations, empathy, and positive discipline. We work with over 130 LAs throughout the UK, including within many existing family hubs, and we've trained over 40,000 practitioners to deliver our programs. We're passionate about the difference that this work makes, as I know many of you are as well, and that's why you do what you do, and that's why you're here. So that's who we are. Our programs are all evidence-based. Decades of evidence fed into developing the Nurturing Program. I'm not going to talk through all of this, because if you want to look at this, then you can visit our website, centreforemotionalhealth.org.uk. Just Google us and we'll come up. And all that you need there in terms of the impact and evidence and details of our programs can be found if you want to know more about that. What I'm really keen, however, to do is to bring in our panel who will be able to talk about the work that they're doing in their fields and their areas, and then get you guys to ask some questions, the kind of things that you are thinking about and would value some help on. So first of all, I'm going to I'm going to start with Lisa, if that's okay. Lisa, you have been using the Nurturing Program as one of your core programs in Liverpool for a little while now. Can you tell us a little bit about why you chose the Nurturing Program and how it works for you? And then we'll move around to some of the others and ask about their experience of using the Nurturing Program in family hubs in their areas. Like I said, I want to bring people in and get questions answered as much as possible. So I've warned the panel of this already. I'm going to be quite strict. So just 2 to 3 minutes if you can, Lisa. I know that's a big ambition, but do what you can.
Sure, thanks, Peter. In Liverpool, the programme was already being delivered by our children's centres. We've got 11 children's centres, and they've got 11 outreach bases as well. So we've got about 22 across the city, and we've got 5 family hubs within 11 of those 11 children's centres. I came into post in 2022 as the new parenting coordinator for the city, and I reviewed our current parenting offer, and we discussed what areas we wanted to improve on to offer universal and targeted parenting groups for our families. We really loved the ethos and the values of the model for the Nurturing Programme, and we knew it was already working with our families in the city in Liverpool, and the impact results that we had already reflected that for us. So we also liked the way that the model was very easily evaluated, and therefore we decided that that was going to be our primary model to use to grow and develop across the city via our Family Hub programme, and we opened up facilitator training to schools and our third sector organisations to widen that community delivery of the programme across the city. So that's the main reason how we've been able to grow and develop the nurturing programme across the city. And we're just about to have our 6th cohort of staff, multi-agency trained in the programme to be able to deliver it across the communities. When we include Family Hub and Children's Centre staff, we're probably coming up for now about 140 practitioners trained across the city to deliver the nurturing programme.
Fantastic. Thank you, Lisa. That's a really, really helpful snapshot of what's going on in Liverpool. I'm going to come to Buckinghamshire now and to Jane. Jane, you've been using the nurturing programme for a while now in Buckinghamshire. Can you tell us a bit about, well, why you chose it, but also how you then made that transition to using it in a family hub way?
Yeah, hi Peter and everyone. 2019, we really moved to make Family Links, as was then in the Nurture programme, our main programme. At that point, we had a review and we were delivering probably 7 or 8 different ones. And I've always said, well, you'd know them all. A lot of video-based programmes that were quite prescriptive. And we wanted something that really, I was aware of the programme, we wanted something that was quite intuitive to the families we were working with. And that's the reason we went with, in 2019, we went and we expanded. And at that point, we went for our targeted workforce. So we trained our targeted workforce in family support. And we started off just with the Nurture programme and then Talking Teens. As that's gone on, working with our partners and working with public health, what specifically we like about the Nurture programme is the mental health element. It's the emotional well-being, and that is what's important to parents. It recognised parents' role, the importance of their emotional well-being. Once you can do that, you can then focus on helping them regulate and help their children. So that's the model, and that's why it worked. Taking it to the next step into the Family Hub. So we're a Family Hub network in Buckinghamshire. We have 3 Family Hub networks, and we didn't receive funding for part of the Family Hub. So we thought, how can we do this? And we decided we had our children's centres, very similar to what Lisa said. We have 16 centres over the 3 areas, so we have a hub and spoke model. But we had then realised that as part of transitions, with the Families First transition and social care transitioning, we needed to have a very large focus on our early intervention partners, as Lisa said, our teachers, our early years settings, our voluntary community, our church faith. And so with public health, we've used it as part of our reason for becoming part of our network as our training model. So if our partners sign up to the Family Hub network, one of the bonuses is they get access to the training that we are then offering, not only the programmes, but also the supervision, the access and the evaluation. So in a very quick synopsis, I think that's where we are.
That's really interesting and fascinating, the way that you kind of pull together partners.
All that fruit out the basket in the bin.
I think someone's got their microphone on. Can we make? There we go. Wonderful. Fantastic the way you've been able to pull partners in across that network in that way. And am I right in thinking, Jane, that there's some training going on today with some partners?
There is,
yes.
And we have community youth on there, we have family time, and we are really going for the universal to the targeted. So we've just signed up all our early years department to look for a parenting puzzle, and we've also signed up our foster and looked after children teams. So we've got the full model. But what I do need to recognise, and I know we've got limited time, is what's made this possible, Peter, is our relationship with you. And yes, I've had a relationship with you for a while with the whole team, but you listen to us and you ask us what we need in Buckinghamshire, which, like all the authorities, is quite diverse. And then we work together, as we did with Keeping Your Child in Mind, understanding our families, understanding what's needed, and then we have the programs that work. So evaluations are important, everything, but that partnership and having that real connection with you, for me, is very, very important.
Oh, that is fantastic to hear, Jane. Thank you so much. I'm really pleased, because that's absolutely something we aim for. So it's good to hear that it's working. Let's jump across to Halton. Adam and Angela, I don't mind whoever wants to chip in first. Can you tell us a bit about how it works for you in your context?
Yeah, okay, I can take this if that's okay, Adam. So I think how it works for us in our context at the moment is going back a few years ago, Nurture Programme was available in Halton, but there was a couple of teams specifically that used it. So I was aware of a couple of community support workers that used it, and they only used it with targeted families who were open to children's social care, and our locality team, who were family support service for 5+, they also had a couple of practitioners trained in it. And they again only delivered that to families who were open on their books. With the funding that was received for family hubs and the increase in demand for early help and family support, and obviously the increase in children in social care, there became a need to have more parenting support that was accessible. And so that we were able to work in partnership with Centre for Emotional Health to train practitioners from across the multidisciplinary teams to deliver and roll out the programme, so that it was far more accessible. So how it works at the moment is the Nurture programme is available to any family who lives in Halton, regardless of whether they're a universal family or they're working alongside children's social care. Of course, the methods for them to come to us very much depends on where they are. So some families will be referred, some families will self-refer. I think it's one of our main programmes because it's so well researched, it's got a really strong evidence base, it really supports those relationships between children and families, and it really works for any family. Those who are used to delivering it will know you'll get families who have children with SEND and neurodiversity, you will have families who are having the normal struggles of daily family life, arguing over homework, and you will have families where absolutely everything is not going well, but there's something on the programme for everybody, and it's a really, really welcoming programme. I think it's different to some of the other programmes that I've seen delivered because it really fits with our community. So some of the other programmes I think that have just been previously mentioned, where they've been written for like American or Australian audiences, they just don't work as well as I've seen Nurture work, and I've been lucky enough to deliver it as well and see the benefits and have those lovely moments of job satisfaction when the light bulbs go on in the group.
Yeah, that's fantastic. And of course, we say, you know your context better than anything. So it's about delivering a program which can be used appropriately in your context. I think that's really important. Flora, I'm gonna come to you in a moment and ask you about National Centre and how that can support what we've heard so far. Before I do that, I want to go to you, Matt, because there's lots of the talk about GLD, good level of development, as a kind of measure of success for this work. Can you tell us a bit more about what that GLD is and what your perspective is in terms of how it fits in with what you've heard?
Yeah, sure. Just to say, there is quite a storm going on outside. So if I freeze or cut off, it's because So apologies, Peter. Just jump in if I freeze. So not really knowing in terms of here how much people know about early learning goals, I might just do a very quick broad brushstrokes just in case. So I'm a full-time head of early years for a school in Peckham in South London. The early learning, the early years foundation stage is built across 7 areas of learning, which basically makes up 17 early learning goals. And there are 3 prime areas, and then there are 4 additional, what they call specific extra areas. And interestingly, personal, social, emotional development is a prime area. And
there's the storm having the impact. The weather is against him.
Education, it must be that this is the focus. And one of the things that I would really stress is that actually, they are extras, and actually part of getting a good level of development is about really focusing on the prime areas, which are communication and language, which I'm sure you all know is really important in terms of supporting families in those very early stages, The second one is the personal, social, and emotional development. And then the third prime area is physical development, so fine motor skills and gross motor skills. So those things are the things that really matter. And out of that, my experience is that sometimes even families, there's this sort of unspoken pressure where they think my child should be writing letters or numbers, and actually that really doesn't matter. Actually, what we want, a bit like Maslow's hierarchy of need, is really focusing on those foundations and getting those well-being foundations, if you like, first. And out of that place, all of the academic stuff comes afterwards. And that's why I think the Best Start hubs are so important, is to help families understand what builds the potential to be a learner. And that's what we want. We want to build this sense of agency and connection with families, where within the early learning goals and the good level of development is essentially looking across the three actually comes, I think, right at the end. Peter, is there anything else you'd want me to specifically talk about?
Can you just, because we're all hanging on the fact that you talked about the 3 and then you froze, and we want to know what those 3 things are just now.
Oh, so yeah, so the 3 prime areas are those 3 things that I mentioned. So it's the communication and language, personal, social, and emotional development, and physical development are the 3 prime areas. And then the other 2 areas for good level of development are the literacy and the numeracy. So those are the things that we assess at the end of reception. And the government's new target, they've just set for 2028, they want 75% of children to be achieving that. Now, that's quite a high target that they've kind of plucked out of the air, if I'm honest. That's not really been in consultation with child development specialists. That's come from somewhere else. But having said that, I do think we need to be aware that children are developing at their own rate. And what I advocate for is progress over this generic everyone reaching the same, because children are coming from all sorts of socio-economic backgrounds, language backgrounds, so actually, if I could say one thing that I think because actually when children have those strong foundations, have I frozen?
You've frozen, and I love that you're building up incredible suspense, Matt, and we really appreciate that. But yeah, the one thing, tell us the one thing.
Well, yeah, just the one thing that I would say that I think is absolutely crucial with the Best Start and beyond is this focus on the personal, social, and emotional. Because actually, when children feel seen, when they feel safe, and when they feel empowered, that is when they develop the skills to be a lifelong learner. And if you get that right, where I am, we get excellent results because we don't actually worry too much about the academic stuff. We really focus on well-being first, and we try and engage our parents to understand that as much as possible as well. So yeah,
that's brilliant. That's fantastic. That's really helpful, Matt. Thank you so much. I'm gonna come to Flora in a second. Adam, did you want to just speak to that?
Yeah, I just want to come in terms of, because I know there's a big emphasis on how the Family Hub programme measures outcomes throughout the kind of journey, and obviously waiting until the good level of development, particularly if you're supporting 1-year-olds or from birth, it's quite difficult to measure. So and there's a comment in the chat around MI data returns, which for people who are on the programme will know that these are the DFE systems of reporting in progress. So I'm sure Robin may be able to answer that one. But just some practical things that we've been doing to try and track and measure outcomes along the way of the journey is to think about what the developmental milestones are along the way and what systems are already in place to use that. So things like results of ages and stages, questionnaires that happen at 12 months for children and 2.5 years. So this comes back to relationships and partnerships with your health colleagues to look at those. Kind of any screening tools that are being used at the moment. So we use Wellcome across Halton. There are obviously others that can be used. And then when you overlay and combine the two together, that then starts to build up a picture of a child. So we're developing ward profiles that bring all of this kind of data into to allow us to adopt a kind of targeted approach to identify need across wards. And then obviously thinking about the family level indicators, which is things that the screening assessments from these programs can help with as well. SD strength and difficulty questionnaires, or if you're looking at perinatal mental health, parent-infant relationships, things like your PHQ-9s, GAD-7s, those kind of screening tools that can all be used to measure the kind of family level indicators. And then across a lot of our work streams, we developed theories of change or logic models. So again, each of our tasks and our activities, we've just appointed some Family Hub navigators, and they have a theory of change wrapped around the work that they do, so they can measure their outcomes, so short, medium and long-term outcomes of the work that they're doing. And all of that wrapped up is hopefully contributing to children achieving a good level of development.
Fantastic, thank you, Adam. That's really helpful. Flora, given what you've heard in terms of both good level of development, but also how these local authorities are implementing the nurturing programme, what can the National Centre do in terms of supporting that work?
Of course, and hi everyone. Thanks so much for having me here. I'm Flora Wilkie. So for the reasons of this meeting, I'm a representative of the National Centre for Family Hubs. I'm a regional advisor for Yorkshire and Humber. I do also work for the LGA as sitting across their children's policy and children's improvement team with a focus on early years. So you might have seen my name come up in other places. So I'll give a bit of kind of context about the National Centre first, because some places may not be aware of us or what we do. So we're really here to provide support to councils, and that's councils that previously had funding as part of the kind of original 75, and those that are now receiving the development grant and going forward. The intention for us is, I suppose, to ensure that councils have the tools and the kind of information that they need. They have the real opportunity to learn from others and kind of gather the evidence that they need to make decisions. The centre itself be running lots of different activities. You might have seen different bits that we've done already. There's been kind of multiple webinars that have been promoted. We're going to have a national conference, and there is also 9 regional advisors kind of scattered across the country in the different regions. Obviously I mentioned I'm Yorkshire and Humber, and hopefully they will have got in touch with you or your family hub lead or your service director or your assistant director to kind of give that initial hello, here we are, this is what we're providing and this is what we kind of want to do to support you. I think Centre for Emotional Health colleagues said that they'll send some links out afterwards, so I'll make sure our website's included in that so you get some information. And I think, reflecting your question, Peter, I think for the centre, I think we really recognise the amount of pressure being kind of placed on councils around the Family Hub and Best Start agenda. There's a real focus. Obviously, areas have their local targets. There's a lot of expectations, and we really want to be able to help councils on that journey of getting to that place where they have really good outcomes for children, and also where feasible, able to reach that target that's been put on them. We really want to facilitate that local learning and kind of the best practice from different places. I think kind of reflected in the conversations from councils today, there's lots of similar themes around things that work, but the real benefit is that people have been able to take these programs, adapt it to the local way of working, and been able to have that kind of confidence in the program. I think really crucial in terms of a colleague from Buckinghamshire was saying that opportunity was around being listened to, having something that worked for the local environment. So we're really keen to work with councils, think about how we do some of that. And we're doing as much as we can to align with other kind of offers of support. We know that there's also, we are separate to we're funded by, but we are separate to the Department for Education. So we're not the ones kind of answering all the policy questions and those sorts of things, but we really want to work closely with the different aspects of support so councils aren't overwhelmed, but they do have that access to those people who, we know that Horton have done some really good work on this. How can they potentially support? I'm not trying to put work onto you guys, but how could they potentially give a lunch and learn or a kind of a conversation around an aspect that they're really proud of to provide some of those ideas? So that's really what we're looking at facilitating, but the centre will also provide bespoke support and kind of peer challenges as well, if there's areas of particular focus that councils want to engage with us on.
Great. Thank you. I'm going to come to the panel. I'm going to start pulling out some of the questions that we've been asked. And I'm going to ask a question to the panel in a moment about the evaluation tools that you use. So I'll come to that in a second. But before I do that, Flora, we've had a question. It would be useful for the current reporting data fields to be shared across LAs who have only just received some funding, so we get a better understanding of what information we will be required to submit going forward. Is this something the National Centre can provide?
I think so. It's definitely something we could initially kind of look at what our regional advisors can start putting out. So I will take that away and see what the options are, and also pick it up in our conversations with DFE about where there are those potential opportunities, so that the newer councils can be advised as earlier as possible.
Fantastic. That's brilliant. Thank you. And then the question that was about evaluation tool is, what evaluation tools are you using to see pre and post scores? Who on the panel wants to pick that one up? Oh, you make me choose.
I don't want to pick it up.
Angela, thank you. Oh, Angela, thank you. Oh, Lisa, you go first, then Angela.
Oh, okay. So for our nurturing programme, because we actually offer Welcome to the World, nurturing, parenting puzzle, keeping your child in mind, and talking teams in Liverpool. And we use pre and post questionnaires for all those programmes. But for nurturing, we use a parenting self-efficacy scale, the TOPSY scale, which measures parenting confidence. So we complete that at week 1, and then we complete it at week 10. And it measures several different aspects of parenting confidence for that group. And I did a bit of a case study evaluation for a term. I think it was springtime last year. I think it was about 25 programmes that we delivered. And we sent the data back to Robin at Centre for Emotional Health, and we waved his magic wand and got all the impact data for us. And it was really, really interesting, because for our Liverpool parents, the main factors of increase for them as a result of completing those TOPSY scales were around improvement in boundaries and guidance for children, improvement in parental control, parents accepting the pressures surrounding them, alongside, having to parent, the external pressures that can impact on their emotional well-being, and then as a result, how they respond in parenting to their children. But we saw increases across all the aspects, play and enjoyment, parenting based on MDB. We saw increases across all of them, but those areas were the main areas for Liverpool with that case study. Now, I've just submitted a lot of new data across to Robin, and he'll be getting that back to me from programmes that we've run from January to July this year. So it's going to be interesting to see the outcomes of that. But very easy to evaluate, doing your pre-questionnaire in your coffee morning or your first session, and your post-questionnaire in your last session. And being able to share that information with parents and families. Look how well we've done, in our group, look how well you've done, where you were when you first came to group and where you are now, how different that is. And it's a big thing for parents, it's a big thing for them to see. So we love using that too. Yeah.
Great. Thank you, Lisa. Angela.
So what I was going to say was the last couple of years really in Halton has been around building the infrastructure of the parenting courses. So this is an area for development for us at the moment, in working with the pre and post things to collect that data. So we've been looking at the use of the the Topsy scale, because traditionally we've used SWEM-Webs, and with the SWEM-Webs, obviously you get information about how the parent's mental health may have changed throughout the duration of the course. But like Lisa was saying, those don't give you as much information about how the relationship between them and their child may have developed or changed. So we have been looking at the use of the Topsy scale and also the parent-child interaction questionnaire, and turning them into pre and post measures. We are also looking at similar ones for measuring the Welcome to the World intervention and the Talking Teens intervention. But from delivery of the programme and the feedback that the families give us when they actually are involved in the programme, they're telling us things like there is improved communication in their family, that they are feeling more closely connected to their child, that there is less conflict at home, and that when it does happen, they feel more confident in managing it, that they have got a good selection of strategies where maybe they came with none or they were using some, but not quite using them in a way that was effective. So that's an area for development for us at the moment. But I think we've got some tools which will show the verbal feedback and the written feedback. I think it'll be reflected in the data as we start to roll those out.
Brilliant. Thank you. Jane.
Yeah, thank you, Peter. I think we're probably to a similar position to Angela. And I think it's interesting, we just moved to Topsy as well for our nurture programme. And I think what we found is the interesting thing is, like Angela says, when you deliver it, you get the feedback each week from the parents, and actually it's very positive feedback. You get the engagement, and it's actually ensuring that actually what those parents are feeling, how does that come across and actually get onto the questionnaires. And I think we've moved to how we collect them, and I think that's just as important as thinking when we have got struggles with our staff, how do we get the data? So we've moved over to Microsoft Forms so we can get them in, so we can get them out, get them over, and also have a 3-month chase up. And I think that's the thing is, yes, we want that data that we can give to the government and what have you and show, but we want to also reflect those softer outcomes and those real things where parents can recognise that they've responded in a different way and they've avoided conflict. And I think that's the thing, it's a bit wider than just the quantitative data. I think having some nice case studies as well is really helpful for engaging with parents, but also helping other professionals help parents, refer parents onto the courses.
Yeah, brilliant. Thank you. Lisa.
Yeah, just on the back of that, we also collate what I call those golden nuggets that parents tell us as a result of the programme. Because it's not just all about numbers. It's about the real things that have happened, that they feel differently about in themselves, in their children. And it's about capturing those as well. So we do capture those comments from parents as well. We also deliver the programme in prisons in Liverpool, 2 prisons in Liverpool, HMP Old Course, HMP Liverpool, and we deliver a lot of our Centre for Emotional programmes there. And we capture some really powerful golden nuggets from some of the dads that we work with in those prisons, and obviously our evaluations as well.
Thank you. Yeah, those lived experience, those stories of lived experiences are so incredible. We have a YouTube channel with some videos on, but we also have a whole number of case studies. The legend that is Robin, who is our impact superhero, he's always available to have a conversation about these kind of things. So do get in touch with him if you want to check in. We also have something called Learning Partnerships, where we work in close collaboration with local authorities. So do check in with Robin if you want to know more about that. I want to a question which came in advance of the webinar, which has also come up today, is about the focus on evidence-based programs that are tied to this, and in particular the mythical list or lists of programs which can be used in these settings. So Flora, I know that there are lists available and the DfE are working on lists. What do you know about advice and support in terms of using evidence-based programs, Flora?
So sorry to not be more helpful to everyone, because I know this is kind of one of the main thing that's coming out, and I know lots of people are waiting for more information about the family hubs, particularly those that got development grant funding to then be able to inform their kind of plans. But the information that we have is that local authorities will be receiving a menu of evidence-based interventions for parenting in the home learning environment to support councils in making informed commissioning decisions. The department is also currently exploring options for centrally providing an online parenting intervention, and further information will be shared in due course. So apologies to not be able to kind of be more helpful than that, but that's the information that we've got from DFE at the moment.
That's helpful. That's helpful. That's our understanding too. So we are currently in conversations with Nesta and also with the Department for Education about providing evidence. So my understanding is that there are a number of lists which have existed for some time, and I think they're trying to kind of create a master list. At least I hope that's what they're trying to do, and then pulling together various evidence bases, and so we're certainly in conversation with the Department for Education on that. We do a lot of work with Barnardo's, and one of their family hubs wanted to use our programs as their core program, and the particular list that was being used, the program they wanted to use wasn't on there, but so they came to us and said, we're being asked for evidence, so we provide them the evidence. They submitted the evidence, and even though we weren't on this, they were able to use it because we were able to supply that. So you know, please feel free to get in touch with us if you think, actually I want to use this, but what have you got that can support us in making that happen? So do be in touch if you need to do that. Okay, let's go back to one of the other questions that came in advance. What issues might prevent an existing family centre or children's centre becoming a hub? So this is very specific about that transitioning from a model that may already be into this Best Start for Families model. Who on the panel wants to start that one?
I can start if you like.
Thanks, Adam.
So yeah, really interesting question. So having a little think about this in advance, and others may comment as well, I think there's probably 3 or 4 things to consider. Firstly, in the guidance, the DFE does provide some kind of oversight in terms of what they constitute being a family hub. So there are definitions to work towards, which are useful to look at. There's also a service expectations guide, and a model framework that outlines specific expectations and parameters as to what families would expect to receive if they are face-to-face within a family hub. So again, useful to work through that as a bit of a checklist and as a bit of a guide. But I think kind of system-wide, I think governance is something to consider. So thinking about the current assets that you've got in your local authority, historically, you know, most areas are using their children's centre assets, but thinking about what are the existing governance arrangements in there. So in a previous local authority that I worked in, the governance for their children's centres was very different to the landscape that I'm operating in now. So they were operating in a commissioning landscape. All of their children's centres had been commissioned out to third sector organisations, whereas in Halton at the moment, all of the children's centres were retained under local authority control, which makes the transition into family hubs very, very straightforward. So governance is something to think about. So who owns the assets that you've got? I think as well, culture. So culture's been a really big thing. So thinking about professional identity. So I think, you know, at the beginning, there was still some reticence around staff around what does this mean from their children's centre core identity? Does this mean I'm no longer a children's centre worker? What does this mean? What do other partners see their role in this identity and in coming into the family hub integrated, co-located model? And then obviously you've got the historic kind of stigma and perception around what the children's centres were and are. So going from that very targeted into a very much more of a universal all access open age approach is something to think about as well. I think from a practical operational perspective, you've got things like space to think about, space challenges, and obviously funding capital funding limitations around, the funding to transition from a capital perspective is not to build brand new buildings, it's to make small minor adaptations to space. So thinking through, and again, if your buildings are managed by other partners, that's again another logistical challenge to think about. And then obviously we've talked this morning or this afternoon around local context and the demand. So thinking about what is already happening locally, what services already exist, and do they have to be local authority buildings? Are there other third sector colleagues that are more best placed to provide family hub sites? So those are the kind of what I was thinking as the 4 key elements to think about.
That's really helpful, Adam. Thank you. Angela.
I was just going to add on a couple of things there to what Adam said. So I've worked in children's centres and family hubs for 20 years, but as the family hubs model came into play, the biggest challenge in the buildings that I was working in was the physical space for the staff to be co-located and the organisation of that first. But then second to that was the increase of service delivery that came with all of those staff. So all of those people came in and now needed to use what were the old children's centre bases for a variety of uses, which had an impact on the universal timetable of the things that were traditionally for under 5s, because we just didn't have enough rooms for everybody to do what they wanted to do at the times that were available. And the other thing that I really noticed was around the increase in the offer around the age range, so the 0 to 19. And SEN, we had early years workers, we have early years workers that continue to deliver what was the universal offer for children's centres, if you want. But when the information goes out about what family hubs are and it starts telling people, it's for 0 to 19s, and people start asking, well, what's here for me 5 and 6 year old, and it isn't there when the doors first open, it can get a little bit tricky, and you can't just add those type of activities onto the job spec of your early years workers. So all of that kind of needs a lot of thinking about in trying to make it work.
Thank you. Yeah, there's so much to consider, isn't there? And I want to move on in a second. I'm going to come to you, Flora, first. I want to move on a second to think about practitioners who are actually doing and delivering the stuff, because I think that's really key as well. Flora, you wanted to come in.
Thank you. I'll be quick, but I just reflecting kind of what Adam and Angela have been saying. We've been speaking to councils who've had family hub funding that have thought quite innovatively about how they use their estate. I think recognising that not every council is in the same space as having a lot of children's centres. There's been conversations about broader community assets, youth centres, all of those sorts of things. Having really interesting conversations with councils who have a kind of campus model where they bring their family hub together with something else, and they have a lot more co-location for older children as well, and the services that kind of support them. And I think there's been a real recognition that why it's been challenging with the kind of 0 to 19 offer, and the funding and the kind of reporting hasn't necessarily followed that entire expectation. It has given councils some of those opportunities to think slightly differently about their governance, how they bring different services in, and how they do support families that have, maybe they have a 2-year-old, but they also have a 9-year-old, and that service offer. So I think it feels quite daunting, but I think there has been some really good, interesting, innovative practice that can be learnt on and built on as well.
Thank you. Yeah, the thing is that there's so much. I mean, working in local authorities is busy and demanding. There's lots of change in local authorities, and this is just one of them. I'm wondering if someone can talk about the what it's been like for practitioners on the journey that you've been on, and what things have been helpful in terms of them delivering this work, but dealing particularly with times of pressure when they came up, because they have done and will continue to, I have no doubt. So I'm wondering what your practitioner experience is. Jane.
Thank you, Peter. I think Angela touched on it. It's you have to be very open and honest and not precious about your space, and you've got to really talk to your colleagues and foster that open relationship where you can really look at the context and actually what are the benefits of actually using that place together, i.e. health visitors with their way in alongside a universal session, what you get with that overlap. But the challenges really come in where we've extended up to the 19, and so for instance we deliver the C card, so anybody 13 and upwards get a specific service, 16 upwards, so for contraception. So actually there has been an element of challenge with our early years setting, saying, well, we don't want somebody coming into the setting for that service with early years. So there has been a real need to have very open and honest conversation and share your outcomes and aims, and say that it's about the bigger picture across the service.
Yeah, that's really helpful. That's really helpful insight. Adam.
Yeah, very quickly. My top tip probably as kind of leading on this piece of work would be to early on coordinate a workforce training plan across the different teams and departments, because we had to really work at pace initially over the first kind of 12 to 18 months. We had competing demands across each of our work streams. Every one of our work streams required some kind of training for the workforce to be undertaken. So we've had training in nurture, we've had training in welcome to the world, we've had training in circle security, video interactive guidance, and generally a lot of these are the same practitioners as well being trained. So we talked at the end of one of our years around, workforce training fatigue. I think having training and professional development has been brilliant for the workforce, but the caveat to that is, while they're still trying to do their job, it can be a lot to try and fit in. So I think adopting a bit of a coordinated, I know areas who've actually recruited workforce development coordinators for this particular purpose, and these roles may exist as well already. So that would be one of my top tips. Try and coordinate amongst different key people the training plan, the training calendar, so things are not coming all at the same time to the same people.
Thank you, Adam. Lisa.
Yeah, I'll just be quick. I think from a practitioner level, for us in Liverpool, the relationships have really strongly developed between our multi-agency partners and our schools and our third sector organisations. And like Adam says, we've probably been trained to death, but it's having, that understanding that they've also got other jobs to do. So when we have trained people, we've asked if they will deliver at least 2 programmes a year and return, data information back to us. And we support them with online peer support groups for practice and to keep in touch with them. But obviously, if the pressures arise where they can't deliver 2 programmes a year and they can only do 1, we're saying, what, that's fine. We're really grateful for what you're doing anyway. So, for us, the strength is in the relationship with the other practitioners. They also know that they can come to us as a parenting team for guidance and advice. And so we've got those links there through nurturing and those relationships, and they know they can approach us for other things. And that has a knock-on effect on, other teams like your family health service and your children's social services. If we can support them to be able to support families at a lower level, then there's less likely to evolve and to need higher level services that cost more money. So for us, the key thing in Liverpool is relationships always, and understanding if they can't do, initially what they've agreed to do with us.
Thank you. Yeah, relationships are so important. And if I don't know if we've lost Matt to the weather. Matt, if you're still there, I'm going to come to you in a minute and ask about early years practitioners and relationships and pressures. But I'm just thinking, as an organisation, we have the exclusive license for the nurturing programme in the UK, and nurturing and the work that is done to train people to deliver the programme, but also to support one another. I'm wondering if you see that in your settings, in terms of how practitioners are able to then actually nurture themselves, but also develop those relationships like Lisa was talking about. What's the ripple effect of the nurturing programme, I guess, is the question. Angela, thank you.
I think the ripple effect of the nurture programme, we talk about this all the time in our office as well. How it impacts you, if you're a parent as well, how you think about your own relationships. But relationships are at the heart of being a family hub. aren't they? And I think that for the practitioners that I've worked with that have trained in the nurture programme, they're not just using that tool when they are in delivery of that programme. It helps to support and facilitate conversations when they're going out doing family support visits, when somebody comes into the children's centre in crisis or the family hub, you know, for some reason. It helps when my previous role was in early help, when I'm thinking about a member of staff telling me about a particular child's behaviour, I'm thinking, right, okay, what have you not told me about their feelings? So it really does kind of spread into other areas. It's like sand, it gets everywhere.
Oh, nice. We need to use that in our marketing. The nurturing program, like sand, it gets everywhere. Matt, thank you for coming back in. I'm just thinking about early years practitioners, and I'm you know, what's your vision for how this Best Start Family family hubs, what could be the potential benefit for people in your position in terms of both the young people, the children you're working with, but also the parents and carers you're engaging with?
Well, I guess, like a lot of people have said, it's that element of trying to stop this very separationist.
Oh, the level of suspense you give us, Matt.
Oh no, it stopped again.
It stopped again, but keep going.
Oh, guys, yeah, just I would love to see a much more joined up process of life. You know, the idea that even within the education system, you know, there's early years, and then primary, and then secondary, and they don't talk to each other. And I think the more that we can develop something of, you know, the human sense of we're all learning, we're all growing. And I think for some parents, the way they view education is a very them and us thing. And I think if we can get in early from the family hubs, the idea that actually we're all in this same boat together, we're all learning. And with practitioners in school as well, I'm always saying to them, don't leave yourself at the door. Like, this isn't a performing thing. You know, you will have your own struggles. And I think the more, what I would love to see is this getting in early to support families and get them on board, so that when they come into an early years setting and a primary setting, that connection and community continues. It's not like a see you later, you've done the you know, it's actually, no, we're with you for life. And I think the earlier we get in, the stronger that connection is.
That's fantastic, and I think you're absolutely right that establishing those relationships right early on is so key and so important. That's fantastic. We are in our last 3 minutes. Katie, lovely to see your face pop up. Can you keep it really quick for me? Oh, can't hear you.
I just wanted to really totally support what Matt just said. I'm from early years background, and I am forever feeling that family hubs are earlier settings already. They're already set up, ready to go. And actually, if we can just be a bit more joined up with the earlier sector and invest a little bit more, like actually, you know, they're getting their funding from 9 months. Those parents are already walking through the door. They're building those relationships. Let's invest in those settings and those workers and those professionals that actually we can make a bigger impact a lot earlier on, Matt, like you've just said, because they are already there. They've made those relationships, and it's not having to go to a separate hub to do a course. It's do it in their familiar surroundings and with the people that they know and love. So really, early years and family hub settings really need to start blending and working more together. That's the big piece of puzzle that needs to be joined, and I hope it comes.
Amazing, Katie. Thank you, Matt. Katie, that's a really nice thing to kind of pull things together, because the Best Start in Life strategy absolutely should make that happen. And I think that so many of us on this call feel so hopeful. And that's why we did this webinar, because we want you know, the very best outcomes for people. I know everyone on this call does as well. I've got a minute to go, which is remarkable that I've managed to get to that point. I just want to say a huge thank you to our panel, to Angela, to Adam, to Jane, to Lisa, to Flora and Matt. I knew that you would share some wonderful experience and wisdom with us, and we're very grateful for that. I also knew an hour would not be long enough, but we know that you're all tight for time, so I hope this has been helpful. If you want to know more, please keep in touch with us. We're on all the various social media channels, but please do email us directly. Alison is our head of business development. There's her email, but you can get in touch with any of us by putting our name in at the beginning instead of Alison. So if you want to speak to our impact superhero, I'm never going to hear the end of the fact I called him that during this webinar, then just put Robin at the front of that and you can touch with him, or indeed me, Peter at emotionalhealth.org.uk. Thank you so much, everyone, for being here. This feels like a really pivotal moment for society, and although we might be frustrated with various governments and the way things are done, this feels like a huge potential opportunity. So I hope this has been helpful. Please be in touch with any other questions that you have. Big thank you to our panel again, and enjoy the rest of your afternoon. Thank you for joining us.